Hi friends, welcome back to my YouTube channel. So first of all, please subscribe to my YouTube channel. Then coming back to our today's topic is diseases of skins. In this video, we will talk about carbuncles, boils, psoriasis, treatment, causes, symptoms, and prevention. So let's start the video. Number one is carbuncles. Carbuncles are painful, deep-seated bacterial skin infections that occur when several hair follicles become infected, typically on the back of the neck, shoulder, or thighs. They appear as cluster of boils and can be quite serious if not treated properly. So this is the definition of carbuncles. So they are the very painful and deep under the skin and look like cluster of boils appear on the skin. Now what are the causes of carbuncles? Number one, Staphylococcus aureus. Carbuncles are most commonly caused by the Staphylococcus aureus bacteria, which can enter the body through the small cuts or abrasion in the skin. And the second cause of carbuncles is weakened immune system. People with diabetes, HIV, and other conditions that weaken the immune system are more susceptible to developing carbuncles. Number third is poor hygiene. Not properly cleaning and disinfecting the skin can allow the bacteria to thrive and cause an infection. So this can causing and forming of carbuncle. Now what are the diagnosing and treatment of carbuncles? Number one, diagnosis. Carbuncles are typically diagnosed through a physical examination and may be confirmed with a sample culture to identify the specific bacteria. So basically diagnosed on carbuncles is test. Treatment often include antibiotics, draining the carbuncle and keeping the area clean and dry. In severe cases, surgery may be required to remove the infected tissue. Home care, applying warm compresses, taking over-counter the pain medication, and avoiding activities that could further irritate the skin can help alleviate symptoms. So in this way we can care the carbuncles. Now preventing carbuncles. Practice good hygiene. Regularly washing hands, bathing, and keeping the skin clean can help to reduce the risk of developing carbuncles. Managing underlying condition. Maintaining good control of eye conditions like diabetes can lower the chances of getting carbuncles. Avoid sharing personal items. Sharing towels, clothing, and other personal items can spread the bacteria that can cause carbuncles. And the fourth one is seek medical attention. Prompt treatment of any skin infection or boils can prevent them from developing into a more serious carbuncles. Now moving toward second topic is boils. What causes boils? Boils, also known as furuncles, are painful pus-filled bumps that form under the skin, and they are typically caused by bacterial infection and often Staphylococcus aureus, which invades the hair follicles or oil glands. So basically boils is pus-filled bump in under the skin and caused by bacteria. Now what kind of bacteria and infection? Number one, staph bacteria. The main culprit behind the boils is Staphylococcus aureus, a common bacteria that lives on the skin and in the nose. Second one is weakened immune system. People with weakened immune system, such as those with diabetes or HIV, are more susceptible to developing boils. Third one is skin irritation. Friction cuts and other skin injuries can provide an entry point for bacteria and leading to boil formation. So this is the basic kind of bacteria that cause boils. Now what are the symptoms and appearance? Painful bump. Boils typically start as a small red painful bump that gradually increase the size as pus accumulates under the skin. White and yellow tip. As the boil mature and white or yellow tip will often appear, indicating the boil is ready to drain. Surrounding redness. The area around the boil may become swollen and red and tender to touch. So in boils, we can see this kind of symptoms and appearance, physical appearance on the skin. Now what are the treatment and prevention in boils? Apply heat. Number one is apply heat. Applying warm compresses to the boil can help bring it onto the head and encourage the drainage. Number two is prevent reoccurrence. Maintaining the good hygiene, avoiding skin irritation, and treating any underlying condition can help to prevent a further future boil. Number third is drain carefully. Once the boil has to come to head, and it can carefully drain by the healthcare provider to release the pus. Now what are the key takeaways in boils? Number one is bacterial infection. Boils are typically caused by bacterial infection, often Staphylococcus aureus, that invade the skin, hair follicles, or oil glands. Number two is painful symptoms. Boils present as painful pus-filled bumps that may have white or yellow tip and be surrounded by redness or swelling. Number three, treatment and prevention. Boils can be treated by applying heat, draining the pus, and maintaining good hygiene to prevent reoccurrence. So in this way we can prevent the boils from certain bacteria. Now moving toward our third topic is psoriasis. Psoriasis is a chronic inflammatory skin condition that can cause rapid buildup of skin cells, resulting in thick scaly patches or plaques on the skin. And these patches can be itchy, painful, and often appear on the elbows, knees, and scalp and other areas. and also the skin looking very dry and very poor condition. Now, what are the causes and risk factors? Number one, autoimmune disorder. Psoriasis is believed to be an autoimmune disorder where the body's immune system mistakenly attack the healthy cells, skin cells, and leading to rapid cell growth. Number two is genetic predispositions. Individual with a family history of psoriasis is more likely to develop the condition, suggesting a genetic component. The third one is trigger. Stress, infection, insult, and medication skin injuries can trigger the worsened psoriasis symptoms. Now, what are the treatment in psoriasis is we see the three different kinds of treatment: topical treatment, creams, ointment, and lotions, and containing ingredients like corticosteroids, vitamin D, retinoid can help you manage the mild to moderate psoriasis. Number two is phototherapy. Exposure to control the amount of natural, artificial, ultraviolet light can help to slow the skin cell growth and reduce inflammation. And the third one is systematic medications. Oral or injectable medication that target the immune system can effective the more to severe resistive cases in psoriasis. So basically we will cover three topics in this video. Number one is carbuncles, boils, and psoriasis and its treatment and symptoms. I hope guys you like this video.